I'd like to take a little time to talk about healthcare reform and some of the tactics that we're seeing among the Republicans and the Democrats. Some 2 or 3 weeks ago, unconfirmed reports, but reliable reports, indicated that former President Clinton advised the Senate's Democratic caucus against getting hung up on the details of the healthcare reform package to fashion a grand compromise and simply get the infrastructure in place. It's clear that the Democrats have taken his advice. If nothing changes, some version of something we haven't seen that will be called the health care bill will become law. Every Democrat politician and strategist is telling us, without shame, that any bill is better than no bill, openly suggesting that they can make whatever changes they desire later, under cover of darkness, as a series of addenda to some other must-pass legislation. You don't believe it? Just look at what they're doing while we're watching them like hawks. Furthermore, it's clear that the Democrats will pass the bill, if necessary, through the reconciliation process with 51 votes in the United States Senate. Senator Reid's assurance to the contrary was a classic head fake, and the Republicans fell for it. The cloture vote to let the bill come before the Senate was tantamount to a vote to let the bill pass via reconciliation. The celebratory Cheshire Cat gotcha tone of the Democrats after the House passed its version of the bill some weeks ago told us at least one thing. They believe that passing this bill is their moral imperative, and they will not let Senate niceties or traditions or rules get in the way of their saving American society from the scourge of the earth, healthcare insurance companies. Just listen to how the Democrats so dismissively and disdainfully refer to their opposition for confirmation of their attitude about their opposition. The Republicans need to counter this with new energy, but no longer on procedural grounds, as that approach seems to have failed. They must challenge the Democrats on the facts, highlighting the loss of freedom that this bill contemplates and will require for enforcement. Read the bill, find its flaws. The ills of this new health care regimen go well beyond it costs too much or the taxes will increase and the deficits will explode. Those words have changed no one's mind, true though they are. Everyone has known for weeks that that's the case, and the bill still has life. If you want to get a flood of voters calling and picketing the Congress, expose the details of the plan. If not, the Democrats will jigger a section here and tweak a section there, reducing the CBO guesstimate of cost by some arbitrary amount, and then say, okay, Republicans, we reduce the costs. Now, if you vote against us, you're just obstructionists. And they'll win that public opinion battle. Need I remind you that it was Newt Gingrich, a sole, solitary member of the legislative branch of the United States government, who shut that government down some years ago. It wasn't the head of the executive office, President Clinton. Newt Gingrich shut the government down single-handedly, so we were told. Further evidence that we need to change our approach? On Saturday, Senator Nelson of Nebraska agreed to go along with the bill because 49 states are going to subsidize Nebraska. Okay, fine. We can't fight what happens in the, I presume, no smoking, smoke-filled rooms. So let's not debate the tactics of any of the members of Congress. There'll be a short conversation in any case. Let's look instead at just one thing the bill's protagonists claim it will do. We're told that the new law will decrease costs, and simultaneously, the healthcare machinery will provide better care. In fact, more and better care for less money. And miraculously, we'll see the federal deficit reduced. Really? Just ask one question. Where are the doctors who have volunteered to do more for less? Or where are the hospitals will make more beds that will make more beds available at a lower cost? Or which nurse is going to work 75 hours next week instead of 60 for the same pay? None of those people exists. That hospital does not exist. The support for this farce is exposed for the lie that it is with just one simple question, yet we can't keep it from passing. Many voters have tried to be thoughtful and helpful in their opposition to the attempt by the Obama, Pelosi, and Reid axis to undermine the operations of our free market capitalist society, but to no avail. When rational arguments are dismissed as fear-mongering, one is not dealing with a fair counterparty. One is dealing with a religious cause, with an antagonist who sees his cause as a moral imperative. Passage of some gerrymandered version of a health care reform bill is inevitable, as evidenced by the fact that the opposing efforts so far have been successful only in slowing down the train, but not in diverting it from its course by even 1 degree. There is a better way, and we will pursue that in the next installment, the unraveling of healthcare reform. Thank you.